Welcome and thank you for joining this final webinar in the COVID-19 and Humanitarian Settings Exploring the Controversial Issues series, produced by the READY Initiative, the Johns Hopkins Center for Humanitarian Health, the Health and Humanitarian Crises Center at the London School of Hygiene and Tropical Medicine, and the Geneva Center of Humanitarian Studies. During this webinar, we encourage you to ask questions by using the Q&A feature directly in Zoom, some of which will be addressed in the Q&A section following the panel discussion. Access to today's recording will be available after the webinar at ready-initiative.org. We also encourage you to visit the COVID-19 Humanitarian platform at covid19humanitarian.com, which curates, analyzes, and interprets guidelines and interventions being implemented in a variety of humanitarian settings to prepare for, respond, and adapt to COVID-19. It is now my pleasure to introduce our moderator for today, from Save the Children, the Chief of Party for the READY Initiative, Laura Cardinal.
Thank you, Ryan, and thank you everyone for being with us today. In our final webinar, we will explore the question, how have COVID-19 and calls to decolonize aid accelerated power shifts within the humanitarian sector or not? I'm excited that we have the opportunity to use this webinar platform to discuss a topic that is so top of mind for many of us working in the humanitarian field, and one that is critical to ensuring effective and efficient responses to major disease outbreaks such as COVID-19 today and in the future. As I learn more about what it means to decolonize aid and the role that localization can play in this transformation, which I should mention is only one piece of the decolonization process, I've had significant moments of personal and organizational reflection. When I look back over my own career, there are certainly moments that I'm very proud of, but there are also moments I wish could be done over. Opportunities missed to engage in more meaningful dialogue, partnerships, and advocacy, which I now know would have made my responses, the responses that I led, more effective and impactful. I welcome the opportunity to continue this important discussion today with our distinguished panelists, and I'd like to take a moment to introduce them to you now and extend my deep appreciation to each of them for taking the time to be with us today. So thank you to all of our panelists. First, I'd like to introduce Dr. Jamila Binti Mahmood, Undersecretary General for Partnerships at the International Federation of Red Cross and Red Crescent Societies. Before joining IFRC, Dr. Mahmood was the Chief of the World Humanitarian Summit Secretariat at the United Nations in New York. She is also the well-known founder of Mercy Malaysia, and in 2006 was appointed by the then UN Secretary General Ban Ki-moon to the advisory group of the Central Emergency Response Fund. Dr. Mahmood is also a special advisor to the Honorable Prime Minister of Malaysia. Second, I'd like to introduce Fouad Jarbawi, Regional Vice President of the Middle East and Northern Africa region at the International Rescue Committee. Fouad has been serving as the Regional Vice President for the MENA region for IRC since July of 2020, and prior to this role, she served as the Regional Director for the Middle East with Mercy Corps, overseeing critical programming and operations in Iraq, Jordan, Lebanon, Palestine, West Bank and Gaza, Syria, and Yemen. Next, I'd like to introduce Karine Delphine Dao. Karine joined Oxfam DRC in April 2019 as the country director. She has more than 20 years in senior country management positions with leading development institutions such as the World Bank, the United Nations, and the European Union, with governments and NGOs in complex development and humanitarian crises. Finally, I'd like to introduce Sonia Walia, the Acting Health Team Lead and Health Advisor for USAID's Bureau for Humanitarian Assistance. Sonia has worked in the humanitarian health and nutrition space for over 15 years and has experience including responding to national disasters, complex emergencies, and outbreaks. Dr. Mahmood, I'd like to propose my first question to you. During your career, you've moved from national to regional to global work and now back to national work within the Malaysian government. You founded a regional NGO, worked with the UN and IFRC, and provided leadership to the consultations leading to the World Humanitarian Summit, which also saw the development of the Graham Bargain, under which signatories have committed to principled humanitarian action that is as local as possible and as international as necessary. From your view, how have COVID-19 and social justice movements that call for the creation of new social compacts in our society impacted the humanitarian response sector and our response to current and future epidemics?
Thank you very much, Laura. Just as a slight correction, I was the former Undersecretary General of IFRC and I'm currently the Special Advisor to the Prime Minister. So thank you for that question. I've had the privilege of actually leading the consultations to the World Humanitarian Summit, and it was there where we heard thousands and thousands of local humanitarian actors, Red Cross volunteers, and also local governments and local businesses really voicing out the importance of local action and respecting context, culture, and the capacities that are actually within countries as well. Now that led to the coining of the term localization, which actually poorly reflects what it truly is. I think that it's about looking at power and where that power rests, and creating the imbalance between the international and the local humanitarian sectors. Now, many might argue that that was probably sugarcoating what the real issue was, and that was racism. And I think that has come up quite recently in many dialogues around, why the sector is the way it is, and probably there are some issues of racism that have now been surfacing and discussed, which is a good thing. Now, one can argue to the cows come home and try to figure out how you create this balance, and it will take time because it's embedded in the culture of humanitarian systems. And I think that, to have that system change will require these honest conversations, but also some real action to take us forward. Now, COVID-19 has really exposed how national action becomes so critical. It's one of those major crises. It's not just a health crisis, it's also a protection crisis. It's a financial crisis, it's a livelihood crisis, it's everything rolled into one, a very complex situation compounded by pre-existing conflicts, natural hazards and disasters, and so on and so forth. But what has become clear is societies organize themselves and they come together in response of whatever crisis that's going on. This has been not just in the developing world, but around the world where this has happened. Now, when I came home to Malaysia and I saw this situation, one of the things that was quite clear is that in a country like Malaysia, which is really middle income, that the private sector was doing things, local society was doing things, local NGOs and national NGOs were doing things, and the government was doing things. So what we decided is, why not use this opportunity to really, pilot and experiment a mechanism and build a platform, not just in terms of coordination, but a real digital data platform where donations are tracked, where they go to are tracked by postcode, and actually showed the entire community who was doing what and where the gaps were. And I think it's been very successful with a long-term vision of capacity development, training, and also at some point, probably accreditation as well. Now, in an environment of mistrust, particularly in my country where there's, there is mistrust with politics and so on and so forth, this has become really quite important to present the evidence on a digital and a data platform. So I think that, the lesson from this is that surely we ourselves need to take more proactive measures to get those, people who are actually the ones moving and trying to provide humanitarian assistance to come together and really build on a narrative of collective impact. I think this is the way we can maybe make some progress so that the value of each will be seen. Now, the other thing, of course, is that we need to also, put the elephant in the room and look at it. And that is really donor behavior. Until and unless donors are willing to address the fact that, that power imbalance will not shift until there are incentives for both local and international organizations to do the right thing, to really look at, where capacity and power should sit, but also, as I mentioned again, that collective impact and building that collaboration that is really required. We know that no one agency can do it alone. And this is, COVID-19 is really, I feel it's the test now we have. It's a field experiment going on now for future crises. And I think we should not, miss this opportunity.
Great. Thank you, Dr. Jamila, for those insights. Saad, now I'd like to turn to you. Saad, with ongoing commitments to localization and growing calls to decolonize the aid sector, what do you see as the changing role of big international NGOs in supporting humanitarian responses? And what do you think it will take to accelerate this transformation? And do you think that COVID-19 has helped or hindered this progress?
Thanks, Laura, and thanks for having me. And I think it's still, in January, we're still allowed to say Happy New Year to everybody that's on the call. And I really hope that 2021 is kinder to us all, brings us peace of mind, health, and hopefully ability to see each other again. So it's a big question, Laura, that you're asking, and I would like to go back a little bit about the foundations of who we are as the aid sector in terms of value and power, because I really think that those are two pillars that inform where we are and how we can move forward. In terms of the value, what has happened throughout the years is that for some reason, humanitarianism has been used as a synonym for Western values. And fundamentally, that has caused this breach and this polarization of the us against them, North versus South, West versus East. Even more so when we take certain values and Western values and dump them as universal. So if we go back, for example, to the Universal Declaration of Human Rights, is it really universal? There was this perspective at the time when it was brought together that it does allow for converging or contradictory values to be put in one space, but we haven't studied that in a way that allows us to say, can we all come around this as universal? The main issue with things being dubbed universal and taken as a general truth is that it means it kills the space for debate. It means that if you come in with anything that is against that value, you then require reform or you have to be developed. So there's that theoretical kind of value base, that exists within our sector. The other one is power, and what we've seen with the Black Lives Matter movement and with the George Floyd unfortunate death and killing is that we've talked about white privilege. We've been talking about white privilege a lot. We've then talked about, the word of is aid a force, a colonizing force or not? I think that can be delayered in multiple ways, but there is an imperial beginnings for humanitarian assistance. Be it if we go back all the way to India when we were talking about the creation of the Famine Code by the British Empire, and what does that mean in terms of deciding who is poor enough to receive and what they receive. Those are all imperial tendencies that have transcended where we are. So I think from my perspective, there is a point of recognition that the power base that we operate under and the value base that we operate under are no longer fit for purpose. They need to be changed radically in order for humanitarian, the work that we do and that we care about and we believe in its value to actually be the one that allows for the impact that we wish to see. COVID-19, Black Lives Matter have accelerated the debate, but only that in my perspective. It's just been a debate. We've not started seeing the transformation that you're asking me about. The worry that I have at the moment with the debate is, again, it's polarizing. It's us against them. Is it about race or not race? And the concerns are much deeper than just race issues. There's multiple things that come in that factor in it, be it nationality, be it gender, be it ethnicity, be it religious, be it I live in the village versus that I live in the city, and what are the power structures that exist in the countries where we're working that then skew the power dynamic one way one way or the other. All of it for me is to what end? What are we trying to do at the end of the day? And it's exactly what Dr. Jamila was saying. Do we have collective impact? And I don't think we have a vision for collective impact as of yet. And in order for us to be contributing to that positive movement along, what the international NGOs must do is first and foremost recognize that we have to have an amicable divorce between Western values and Western ideologies, with what it means to be humanitarian, but also that we cannot use that Western grid as a way to indicate we trust you to be the only competent organization, that can do the work. And that comes to the relationship with the donors. The second one is a firm belief that we can't do it on our own. It is about power, and it's about the recognition that the term localization, which is a bit condescending, right? That humanitarian assistance has always been localized. At the end of the day, it is not us, those that don't belong to the country, that are doing it. We're just managing behind our screens. It's people from the country that are doing it, and it's them that will always bear the effect of what's happening in their communities. And so the time has come for us to fully recognize that and take the back seat in a humble way and say, we are here in support of what you require. And then the third one for me, which is more important, is we sing to the tune of we are here to serve. But in reality, we're not serving, because we don't put the people that we're serving center stage. We put our donors center stage. We create processes and systems that allow us to be accountable to where the money comes from, but not who is receiving the money. That requires a fundamental change in our operations and processes. To bring it all together, we require more transparency. We should be very comfortable in showing the world what we're doing, what we're not doing, what's working and what's not working, and to be held accountable to it, to a point where I imagine a world that there is institutions or bodies that exist to rate our work as international organizations based on a grid that is outside of Western values. I'll stop there for now. Thanks.
Thank you, Saad. Thanks so much for those insights. Karine, I'd like to turn to you next. As the leader of a major INGO working in a country with a long history of humanitarian needs and major disease outbreaks, how do you feel investments in local partnerships and community engagement have contributed to effective responses to major disease outbreaks, including COVID-19? And how are these relationships important for long-term development gains?
Thank you for the opportunity. As you know, Oxfam in DRC has been at the forefront of all the major crises that has affected this country over the last few decades. And this has indeed been a long learning process, and you are still learning. But one thing that came out very strongly, and that puts at the cornerstone of this debate, the engagement of local actors and the issue of local partnership, is how sustainable is our contribution to eradicating these disease and pandemics. And also, most important, how fit are we to play this role as an international community? In fact, in DRC, there is a saying that, to me, kind of capture what the debate is about. In DRC, we say casually that what is done without us is being done against us. And this is something I think is critical for this discussion. What I'm seeing as country director, as part of the humanitarian development world in DRC, is the fact that COVID-19 pandemic in DRC is testing us. It's a lesson of humility. It's showing us on a daily basis that we need to do some kind of self-reflection and see how we can do things differently. And this doing things differently is straightforward. We need to be putting more emphasis on working more with local actors. What is at stake here is even changing the narrative. This is not about merely building capacity of local actors. I've heard some very challenging remark from the beneficiary. How dare you come to us and say, oh, we are building our capacity? What we are expecting from you is for you to transfer skills. The local partners that we work on a daily basis have access to resources social resources that sometimes we don't even know they exist. And they are also being more and more keen on us being accountable. And without them at the center of our response, it's not possible to break the virus, to break the contagion for COVID or Ebola for that matter. I want to really emphasize something. What we have learned from our work with local organizations is 3 key points that I wanted to articulate here. First, our work with Ebola actors in the ground, the resistance that we face, we have seen in action that when you go in communities, in order to get the trust, in order for them to be fully engaged, your workforce has to be as diverse as the person that you serve. I think that's a very important point that somehow we are missing. This is not about race, it's about being diverse so that you resonate to the people that you are meant to serve. The second lesson, we need to prioritize connection and supporting coordination between local actors. This is critical because this is most of the time the missing links that make it difficult for local actors to build resilience in the community that we serve. And lastly, we need to be flexible and we need to decolonize our minds. At the end of the day, the humanitarian landscape that we know, like even in the case of DRC, humanitarian intervention in DRC have changed drastically over the last 2 years. One of the reasons being that the leadership in the country has changed. The other reason is that the people in DRC are also changed. You have more and more people at local level that expect humanitarian actors to be more accountable. And how that affects a longer term prospect for development is critical. So unless we are able to really look deep into who we are as community and start doing this radical shift in the way we approach our support in those crisis time, I'm afraid we'll be missing our mission. I'm glad that my predecessor has touched on the issue of localization, the issue of our commitment to the duty of care to the people you serve, but the lesson from our work with local organizations is very clear. What is being done without us is being done against us. And I think that's a starting point for this discussion. And we need to change the way we approach it. Thank you.
Thank you, Karine. Thank you so much. Sonia, now I'd like to turn to you. As a key donor funding COVID-19 response in humanitarian settings, what do you see as the challenges to localization during large-scale infectious disease outbreak responses in these humanitarian settings? How can we as a humanitarian overcome these challenges and ultimately decolonize our responses?
Thanks, Laura, and good morning and good afternoon, everybody. I wanted to start by framing this discussion on defining what we're talking about when we say humanitarian context. Now, over 80% of these contexts are now conflicts where national systems are broken, and working directly with national governments can be difficult when trying to preserve impartiality, neutrality, and independence. National and international humanitarian health partners are working to provide life-saving assistance, including responding to disease outbreaks in these very complicated environments. I have many thoughts and ideas that I wanted to share with you, but in order to sort of streamline my thinking, I've tried to manage them in 2 buckets. How we actually implement our operations and funding. So I'll just jump right in. And I think one of the challenges we have faced in responding to large-scale infectious disease outbreaks in these complicated settings is the over-reliance on a clinical response. The focus tends to congregate around high-level inpatient care, ICUs, and ETUs. Community engagement and communication seems to be an afterthought, only thought of when people are not self-identifying and presenting at these very resource-heavy and expensive facilities. We keep missing opportunities to involve local partners who are part of and know the community, and we focus on this medical response instead of the public health response. We've seen this play out time and again in different disease outbreak responses, including Ebola, COVID, and cholera in Yemen. We then tend to look at these local groups and communities as homogeneous, and we fail to recognize that there are many different groups within these communities and they have many different needs. How can we leverage what other sectors, such as the protection sectors, has done to establish local networks like they've done for gender-based violence prevention and response? We are building the plane and flying it. I know you've all heard this expression many times before, and we know the challenges of rapidly responding to a large-scale disease outbreak while building coordination and capacity, yet we seem to keep falling back on this method. We know how important it is to have local organizations engaged and involved in the response, so why do we wait for the outbreak to include them? How can we advocate with those development actors and stakeholders that are involved in outbreak preparedness to meaningfully engage organizations? How are traditional healers and local pharmacies involved in joint external evaluations, for instance? How do we work with WHO and UNICEF, who support both preparedness and response, and work with governments to consider these local actors when developing these plans? How do we prevent, detect, and respond to the priority needs of the communities and the organizations and not what we think is important? And how do we do it in a holistic way? I think one of my panelists said it best: we are in support of what they require. I've often lamented how public health experts have been ignored and our expertise has been overlooked, especially in the last year. I think about the vaccine rollout here in my home country, which is a military response instead of a public health response. And I wonder if our colleagues with organizational development expertise feel the same way. When we talk about building the capacity of local organizations, are we ignoring the expertise of our colleagues in organizational development? How can we, as humanitarian health actors, engage them to help us meaningfully support local organizations, and not just during disease response, but even before? How have we used tools and lessons learned identified by the Emergency Capacity Building Project? I think we need to acknowledge that this is a skill set and to use this expertise better and truly invest in human capital. Risk deferment in conflict and COVID. As donors and expats, we have tight restrictions on where and how we travel, and we have increasingly deferred our risk to our foreign staff, our national staff, our local partners, our local Ministry of Health staff, community health workers. What support have we given these staff and these organizations on managing risk? And how are we accepting this colonization of the response? What are we doing to change it? What tools are we giving our partners? How is impartiality and neutrality affected when local groups are working in their communities on disease response? What challenges do they face to this? What about when they themselves can't work in certain areas because of the way they look? Our response is usually to keep them away from these areas. Or do we feel that our presence is actually needed to quote unquote keep them safe or quote unquote do the right thing? Isn't this also part of colonization? Lastly, as donors, reflecting on how aid is directed towards countries during disease outbreak response. The most notable example is the West Africa Ebola response, with US leading Liberia and the UK leading Sierra Leone and France leading in Guinea. I don't honestly have an answer, but I wanted to note it, especially because it led to a very different response and different epidemiological curves, and most importantly, increased distrust. I also think it's important to note that we at Usaid have challenges in funding local organizations directly due to our policy and legal requirements to safeguard taxpayer dollars. We are working on improving this. We tend to support local organizations through umbrella grants or sub-grants, and this can be slow. We have seen that program shifts and approvals for these shifts take time and can lead to losing national staff and local partners. And this can also be considered a colonization of the response. As a donor, we are open to your ideas as you are closer to the local level than we are, and we need your help. So while I don't have many answers, what I note is that we continue to observe the same problem. Disease outbreaks disproportionately affect and impact vulnerable groups, and involvement of local groups is crucial to a response. So how are we as a humanitarian health community shifting our way of thinking on how we respond? Thank you.
Thank you, Sonia. Thank you so much for those insights. I'll encourage everyone who is on the webinar to please put your questions into the Q&A box, and Ryan will be looking through those and sending those to me. But before we open up to the audience, I just wanted to give the panelists the opportunity to respond to some of the comments from the other panelists. Dr. Jamila, maybe I'll start with you.
Thank you very much. Thank you so much for this great discussion from my co-panelists. I just wanted to really highlight what Sonia said, that we have a tendency to manage crises through very siloed approaches. And now, with this pandemic, we are being really exposed on different levels, right? And therefore that public health approach, that general approach has become so critical and not medicalizing a pandemic. And I say this also because this is where local action is so important. Let's take the example of the Ebola crisis in West Africa. My former organization, IFRC, through its volunteers, were able to mobilize community health volunteers, other volunteers as well, other organizations and local actors. And through the safe and dignified burials of Ebola patients, the Lancet has, showed evidence that it reduced the number of deaths by probably 10,000 people. Now, you might not think burying people is a humanitarian action, but actually it actually saved a lot of lives. So it does require a public health approach. In a pandemic management, the medical bit is only one part of it. Everything else, we haven't even started looking at mental health, the long-term implications of mental health on everyone, including us, right, who have been impacted by the pandemic as well. So I think I really fully support this call for broad public health approach and really using every opportunity we can to find ways to connect dots rather than take siloed approaches.
Great, thank you so much. Suad, did you have anything that you wanted to add?
Sure, yeah, I can go back also to what Sonia was saying, because I think it fits nicely with Dr. Jamila and Karine's comments. It is this the three values of impartiality, neutrality, and independence that we continue to talk about in our sector, but in terms of implementations, they're not there, right? We are not independent. We are instruments of foreign policies. Depending on where we get the money, we try to diversify the money to be unleashed and shackled from that, but at the moment, we're not fully there. We are not neutral. We have sides, we have perspectives. We come in as NGOs, with a decision of who's good and who's bad, who's right and who's wrong, who's evil, who's not, quote unquote, right? That binary approach, which is exactly what got us in this kind of more of a Western, the Western framework that I was talking about. They that are not like me require development or reform, right? Rather than what is the experience that they're living through, what do they require? Can I be of support or am I of no use, right? That kind of reflection is not there and it's not inherent to who we are. So I think that as we move forward in terms of what does the humanitarian sector look like in the future, I do think that we need to be really hard thinking about those three values. I think I'll share one example that I heard recently, and it really rang true. When we joined, I'm Palestinian, and I have not worked in Palestine in the humanitarian sector because somehow, somewhere along the line, I was formatted that I will not be independent or impartial enough to work in my own country. And so somehow I took that to believe it and continued to work in other places, predominantly in the Arab world and in Africa. And then this comment that somebody said is when crisis hit in Europe and we had refugees flowing into Europe, nobody said, where is our Congolese colleague that is going to lead this crisis in Greece to ensure neutrality and impartiality and independence? Rather, everybody turned into, where is the Greek that can do that? Where is the German that can do that? In France, who is there that can handle the situation happening in Calais? And nobody paused and said, there's a discrepancy now. There's a double standard, whereby if you're talking about the quote unquote, the Cold War gave us the third world coin, right? The third, if you're talking about somebody from the quote unquote third world, then they are not good enough to be working in their own countries because they're going to be subjective. Instead of saying, because we are from the countries where we operate, the impact that we will do will far exceed any impact that an external body would do. It will be profound, it will be right, it'll be contextually appropriate. That's the disentanglement that we need to happen, that needs to happen as we move forward. And that means those that are, I'm speaking in generalization right now, so forgive me, but if we talk about the Western face of humanitarian aid, that Western face needs to understand the privilege that it carried and be willing to give it up. And that's not happening as of yet.
Thank you. Thank you, Sawad. Karine or Sonia, would you like to add anything?
I would just like to echo on some of the things that she rightfully articulated. And one thing that is clear is that we are seeing a shift. We are seeing a shift in the leadership, diversity of leadership in major NGO. And one of the results of that, we have seen fewer and fewer instances of difficult relationship with national governments. And one thing, for instance, in the case of DRC, you see at central level, provincial level, people in decision-making capacity, most of them come from the NGO world of the UN. So the way we engage with them is different. They expect us to be more accountable, but they're also more open to understand and listen to some of the hard discussion that sometimes we have to make on behalf of the people that we serve. And I think now with the Black Lives Matter, the time is about right that we continue this conversation. And it's somehow very comforting to see that some of the organizations have made it very public that the leadership will be more diverse. But what it means for us is that this also have to come with some having in place internal mechanisms for performance assessment on individual that take away this perception or even building white privilege or any privilege of any sort, so that we are all in an equal footing. Because anything that you don't live within an organization, it's very difficult for you to articulate that within the community that we serve. And people see what you are doing. We are in a global world. Everything you do now, the beneficiary will know exactly what's working, what is not working. So now is a chance for us to really go and have and be more bold, more assertive in being who we are, and also serving the people that we committed to serve. The time is right, definitely. And I'm glad that we are having this space where we can have this controversial discussion. This is really a very big step in the right direction. And I'm glad to be part of this conversation.
Laura, if there's time, I just wanted to add something that I actually struggle with in terms of implementation. And my example is actually the DRC Ebola outbreak in North Kivu and Ituri. And I think what I struggled with quite a bit is, and I've talked to my colleagues about this as well, is when the government in charge of the response is not open to involving local actors and communities. And this is where I think I struggled so much, because I recall like IFRC doing so much great work with the community feedback mechanisms and getting all this great information on what communities wanted and didn't want to see in the response. And the larger response didn't listen. And we saw the results of that. we saw ETUs being burned down. We saw our MSF colleagues really in the thick of it. And I think that is what I struggle with, because we saw communities asking to be involved, and we saw the different groups within communities asking to be involved. And I know that there were a lot of international organizations that were trying to lift the voices of these different actors within the community, and their voices were not able to be heard because those in charge of the response did not want to hear it. And so I think what I struggle with in disease, outbreak response is, how do we work better to advocate? And I think that's where I start to think, well, okay, maybe we leverage WHO and UNICEF, but I can say that that was difficult too. And so I'm really looking to see, like, how can we do that better? How can we also get whoever's in charge of the response to understand how important these groups are and how important it is for them, these groups within the community, to lead the response and to gain trust.
Thank you. Thank you, Sonia. I'm going to move now to audience questions, if that's okay. So I'm looking through the questions, and because this is a controversial issues topic, I'll try to pick a few of those to really challenge our panelists. So the first one, which I will open up to anyone who'd like to jump in. Many social movements around the globe, including Black Lives Matter and the Free Palestine movement, include abolitionist strains in their demands for social justice. Abolitionism advocates for the complete dismantling of oppressive systems to be replaced by new ones. In the humanitarian sector, are there ways to reform the current systems and institutions that are largely Western funded and led, that currently govern our sector, or do they need to be replaced entirely? Can localization ever be part of a decolonial practice when it is led by Western NGOs and donors? Any of our panelists want to take on that question? Karine, go ahead.
Okay, so my take on that will be that localization definitely has to be part of it, part of the answer, if not the answer, but definitely part of the answer, because what we are seeing in the ground, in the context of the ongoing COVID response in DRC, is that we have been able to kind of make some progress in the way we deal with this pandemic when we started engaging with the local stakeholder at all three levels. For instance, in DRC, the government has set up a Conseil Consultatif, which is a committee, strategic committee who advise the government on how to deal with the COVID pandemic. This strategic group was initially not open to NGO, but through our personal network, personal relationship in country, we're able to be appointed in that group. And having somebody, maybe with the same kind of cultural background as them, coming to them and trying to put on the table some of the things that call for hard discussion, was able to change the dynamics of the relationship with the government when it comes to addressing the COVID pandemic. One of the things about localization, I think we need to take it on the two-way side of perspective. One thing is to empower the local actors, but the other thing is also create a space for whoever has something to contribute to be allowed to do so. And I think that's part of the discussion that somehow we are missing. That is tend to be more like them against us, while there is a space for everybody to contribute. And as humanitarian actors, it's called for more humility. We might have people in position of leadership at country level who might not have the best intention, but still, in order for you to influence positively somebody, you need to gain their trust to bring them to the table. And with COVID, unless you bring them to the table, it's becoming more and more difficult because this is a new way of living. And now in DRC, we are trying to put together a national coalition for the people vaccine. In order for us to do that, we need to bring the government at the table. So bringing the government at the table means that having people who can have the kind of discussion that will resonate with them. And the local actors are definitively critical in making sure that this discussion take place. And we win the trust. We are not being perceived as foreigner coming in the discussion to dictate what we want to our benefit, to prevent the government or the local actor to play the role, but as enabler. And this is what we should strive to be doing in the current context. Thank you.
Thank you, Karine.
Laura,
that is a great, yes, please,
sorry,
Sonia.
I just wanted to add to what Karine was saying, and I totally agree. I think that having that space, and how do we get that space? And I think that's the thing that we struggle with, is how do we ensure that space for local groups and communities? And, you know, I think that's what I was trying to say earlier, is how do we get their voices involved in, you know, when we have EOCs, when we have like these coordination structures, who is involving them when we're setting up these coordination structures? Who is asking them, is this what you want the response to look like? Do you want to see, you know, 100 white SUVs driving through your community every day? You know, I mean, and I think, I agree. I think we definitely need to figure out how to rebalance, refigure how we do the response. And I think it's really important. I've seen a couple of questions in the chat on, you know, what we as donors can do. And, you know, it's a hard question. I don't pretend to know the answer, but I do think that the advocacy on part of all of you to say we need reform, and we need to have the space to have this crucial, you know, input and dialogue with our, you know, with the people that are actually affected and going to be doing the work, is so important. Thanks.
May I have the final thing to that?
Sure.
Sorry, so I think
No.
maybe the way you are able really to trigger this reform, to make sure that it's actually happened, you take action. When you look at what has been happening with safeguarding, now anyone that was trying to secure funding with a donor has to have something about how it's going to address the safeguarding risk. One thing will be to consider doing the same thing for localization. When you put together a proposal, how do you ensure that you'll be transferring the skills to the local actors? I think that can really make a difference. And that also calls to the responsibility of donors and policymakers in the developed country and in fragile country as well. But this is critical, the way we ourselves extend our funding. What are the requirements to make localization a cornerstone of the way we engage with the donors?
Thank you, Karine. Saad, I have a question for you from the audience. How do we shift the values and our operations in order to make our humanitarian interventions people-centered instead of donor-centered? And how can we more effectively move away from the Western-influenced interventions?
Yeah, I had read that question, and I think it touches on the question that you had paused on before, on evolution versus revolution. And I frankly believe it's a combination of both. Again, it feels very detrimentalist if you're either here or there, and not accepting that life is not linear and change happens in bits and pieces and in an organic sense, but that we need to have that commitment to change it. So for me on that question is the irony in everything that we've been discussing is that our humanitarian aid is not the most human-centered, and that's the main issue. And so in order for us to, let me start with what we shouldn't do. What we shouldn't do is go towards what Karine was alluding to, which is a facelift, i.e. Off with their heads, all of them white people at the top, and bring in the non-white people in, and accordingly we're diverse, and accordingly power automatically balances itself out, and thus we've done the change. That's superficial, that's tokenism, that doesn't get us to where we need to. And let's recognize that privilege is not just limited to those who are white. I am as white as can be as a Palestinian. Until today, I am near 40 years old, and I have lived my entire life under occupation, not being in control of my own destiny or that of my family. And at the same time, I fit in the global elite because of my trajectory, my career, and my education. And thus I am unprivileged in certain way, but privileged in the other. What I had to do, and I think this is to the point of the question, is in order to make it in this sector, I had to assimilate. And that's the bit that we need to change. I speak English with an American accent. I can speak about every cultural aspect of what happens in the United States because I needed to learn it. I could do the same for the UK. I could do the same for France. I have to do the same for any donor country that I interact with. Know the ins and outs, the jokes, the whatever it is, as part of my assimilation to gain trust in order for me to be seen as competent enough to deliver. Never in my career, I think maybe I'll give you maybe on one hand count the number of my colleagues that have worked in the Middle East that speak Arabic. And I can tell you that 0 of them speak it in a way that is in professional setting, able to write it and able to read it. But yet I have the requirement to speak English. So those are the values that need to be automatically stripped away and disentangled from competency to actually allow us to understand that the term localization is Western conceptualized to allow us to soft launch or soft land a small change around the edges so that we continue to be comfortable in what we currently have. What we're trying to do is say, let's not do the off with their heads, but in terms of rebalancing, it is people like me, it's people like you, Laura, in your reflection saying enough is enough. There's a different way of doing it. That different way starts by making sure that the person that's sitting in Zatari camp or that person that's sitting in Mosul is center stage to the equation. And that I, even though I am from Palestine, I'm not the most versed in what's happening in Zatari and Mosul. And accordingly, the only thing that I could do is humbly allow my expertise to assist those that are part of the community. If we're not able to do that, then yes, I'm all for the dismantling, absolute dismantling. Over.
Thank you so much. Yes, Dr. Jamila.
I mean, spot on, Suad, beautifully said. And I think this is precisely the issue. As I mentioned earlier, localization came up from a series of consultations because it was an easy term to land on and was apologetic to an extent. I think we've got to break that language, and I think let's call a spade, right? If you're serious about diversity and inclusion, start from where that person is and not from where you came from. So I think that view of diversity and inclusion, which lens you use, is also equally important. So I think, why do we have to conform to what those standards are set out for us rather than creating the standards based on where we sit? So I think that is very important.
Thank you, Dr. Jamila. Dr. Jamila, I wonder if you could start us off talking about what you see as the role and responsibility of local governments in decolonizing aid, in moving forward the commitments made under the Grand Bargain.
Yeah, I think this is the missing piece, right? The humanitarian sector talks to each other, And then, when it feels like it will talk to local organizations, and then, you forget around the local organizations, there's a completely different ecosystem of local business, local government, and local, self-organized groups, whatever, which are not formal. So I can speak from my experience here with the COVID-19. It is really about local governments, forming their own committees and then seeing what the needs are at that level. And although at the big challenge, even in a national context, the federal system will want to implement things as a one-size-fits-all. And we have local governments pushing back to say, hang on a minute, that's not how the disease is going on in my state or my district. And that's not how the livelihood development is in my place. So again, even in a national context, without any international actors, we face the same problems that sometimes federal also wants to have a say in the local response. So it's not unique to the humanitarian sector writ large. So I think this is where when we built this platform for coordination, it really, because we went by postcode, so we could actually tell by postcode where the needs were and who was going to meet the needs. So it just became this a transparent platform where we could actually say to NGOs that didn't trust the government, hang on a minute, but these are all done by government. And in some places, there are 6 NGOs there. Why? Why aren't you distributing to other places? At the same time, businesses saying, why are you funding only certain parts of the country? So I think, at the end of the day, it's about data, evidence, and, transparency. I think we've got to push for a system that is based on data, evidence, and transparency.
Very well said, Dr. Jamila. We have just a few moments left. Would anybody else like to comment on the role of local governments or local actors in pushing forward the changes we've been talking about today? Please, Fuad.
Yeah, I think it's important for us to recognize also that let me go a little bit in history. The Cold War gave us, as I was alluding to before, first, second, and third world labeling, and and we haven't moved away from that. We unfortunately, and so because we haven't moved away from that, we think and dismiss that every government and local government incapable of handling a crisis as incompetent. And that is the wrong starting point. It's a condescending, and it is the privileged, power hogging point that we talk about. I do think that, and the world is not pure about good and evil, right? And we have just come to learn that the United States is not actually the beacon of democracy it has prided itself to be for all of these, decades in terms of checks and balances and whatnot. And so it's an interesting point to say, certain parts of the government sometimes are oppressing, not all of them necessarily. There is always a point, an entry point that all of us have the obligation to be working alongside, not capacity building, not telling them what to do, working alongside so that we understand from their points as the ones responsible for the social contract with their citizens, where are the difficulties and can we help them or can we not? This is the same thing for me that I keep on saying about working or making sure that those local actors come first and we come second, because local actors at the end of the day are part and parcel of that community fabric. They're there to stay. And so we can come and do the sub-granting model of you're a partner and here you go, move forward. And then we walk out, but the community and those that they've helped or worked with still expect them to provide, and we've left them. And so unless we recalibrate that equation, then we've fundamentally prolonged crises, prolonged poverty, prolonged need, and created a business for ourselves.
Thank you, Suad, and thank you. We are at time, unfortunately. I personally would love to continue to talk for several more hours and get some of my own questions in there to all of you. Dr. Jamila, Suad, Karine, and Sonia, thank you so much for joining the webinar today, for all of your open and candid discussion and your candor on these really important topics. You've given us a lot to think about and to discuss within our own organization and our own teams. And we really appreciate you taking the time to be with us today. So thank you so much.
Thank you.
Thank you, a privilege.